Over 90% of all hospital patients receive intravenous fluids administered through an IV, and performing a safe and successful venipuncture is the heart of intravenous therapy. As recently as 2004, the Centers for Disease Control, or CDC, estimated that up to 800,000 contaminated percutaneous injuries occur annually to healthcare workers in both hospitals and other healthcare settings. Of these injuries, the greatest risk of seroconversion to blood-borne infections such as HIV and hepatitis B and C viruses is from blood-filled hollow-bore devices like IV catheter introducer needles. Retractable Technologies has developed the VanishPoint IV catheter to answer the demand for a safer IV device and meet OSHA's criteria for an engineered Sharps injury prevention device. The VanishPoint IV catheter is designed for safety. It is easy to use and allows for one-handed venipuncture. It contains an integrated safety mechanism that, when activated, quickly and safely retracts the introducer needle, which remains safely retracted inside the housing until disposal. The catheter remains in place for normal IV use. VanishPoint catheters are available in a variety of sizes, each color-coded according to international standards to indicate the catheter gauge. Unlike other IV catheters, VanishPoint IV catheters do not require additional components such as sliding sheaths, metal clips, or activation buttons. The VanishPoint IV catheter is composed of an introducer needle and housing, which includes a retraction mechanism within the housing and finger grips for pulling back on the housing to activate the retraction. The finger grips and flashback chamber are clear to allow for flashback visualization. The end of the housing is color-coded to indicate the catheter gauge. The catheter hub is also color-coded according to international standards to indicate catheter gauge. The push-off tab facilitates one-handed hub advancement and indicates bevel orientation. Now, let's take a step-by-step look at using the VanishPoint IV catheter. Select and prepare the insertion site with an appropriate antimicrobial agent according to your facility's policy and procedure. Remove the needle cover and inspect the catheter unit. The bevel-up orientation of the introducer needle, as indicated by the push-off tab, allows clear visualization of the flashback chamber. Hold the VanishPoint IV catheter device with your fingers positioned as shown on the finger grips of the housing, keeping the fingers well behind the needle. Perform the venipuncture. Observe for blood return. Then advance the catheter slightly to ensure full catheter entry into the vein. Holding the flashback chamber stationary, disengage the hub from the introducer needle, advancing the catheter into the vein. Do not reintroduce the needle into the catheter at any time. Before withdrawing the introducer needle from the catheter, retract the needle. To do this, stabilize the color-coded end of the housing in the proximal portion of your palm and pull back on the finger grips of the housing. The needle will retract into the clear housing. Let's see that action again from below. Note that the end of the housing is pressed into the palm. Pull back on the finger grips and the needle retracts into the housing, reducing the risk of a needle stick injury. You can see the spring and needle entirely within the clear housing. Then attach IV tubing or an adapter to the catheter hub as you normally would. Secure the catheter in place and dress the site in accordance with your facility's protocol. Dispose of the introducer needle in an appropriate Sharps container, following the policy of your institution. So far, we have watched venipuncture with the VanishPoint IV catheter performed very slowly or in stages for clarity and learning purposes. Of course, in daily use, the VanishPoint IV catheter is so easy to use that the entire procedure is as quick as any venipuncture. The VanishPoint IV catheter minimizes exposure to the contaminated needle. If used properly, the needle is automatically retracted into a housing, effectively reducing the risk of needle stick injuries, and can then be properly disposed of. VanishPoint, safe venipuncture for you and your patients.